We're covering extrinsic eye muscles, and these eye muscles are towards the exterior of the eye. Intrinsic versus extrinsic. So extrinsic is controlling the eyeball and movement of the eye and the eyelids, versus intrinsic is looking at how we focus the eyeball to receive the light and interpret what you're seeing. So intrinsic is something like the ciliary muscle that helps with controlling the lens, versus this is the external or extrinsic eye muscles, and I typically will organize them based on the cranial nerves that impact them, because we have cranial nerves 3, 4, and 6. 3 is oculomotor, 4 is trochlear, and 6 is abducens. These are the 3 nerves that control our extrinsic eye muscle movement. So if we start with levator, palpebrae, superioris, this is the one that controls the upper eyelid so I can look up, but this is controlled by oculomotor, cranial nerve number 3. The other ones that are controlled by oculomotor, cranial nerve number 3 is superior oblique, and that helps us to look up. Inferior rectus, so inferior rectus, that helps us to look down. And then we get into medial rectus on the other side, the medial side of the eye, and that helps us to look medial towards my nose. And then lastly, inferior oblique, because it runs at an angle, and this helps us to roll and look up laterally. So roll and look up laterally. All of these are controlled by cranial nerve number 3 of my oculomotor. So oculomotor, cranial nerve number 3 controls my levator palpebrae superioris, my superior rectus, my inferior rectus, my medial rectus, and my inferior oblique. And then I get into cranial nerve number 4, which is trochlear, and it's superior oblique that controls this muscle. So superior oblique is controlled by the trochlear nerve number 4. This helps us to roll and look down laterally. So roll and look down laterally versus inferior oblique, roll and look up laterally. So controlling my superior oblique, trochlear nerve. And then lastly, when we look at abducens, to abduct, cranial nerve number 6, abducens is controlling the lateral rectus. So lateral rectus helps us to look laterally. So as we identify these, pretty straightforward. I just look at it. This is a right eye, and I know this just because of the way the inferior oblique is coming over. But if there's 4 sides, these are our 4 rectus muscles. So I have superior rectus, I have lateral rectus. I can't see the medial on this side. I have inferior rectus, and then my inferior oblique is running this way. So if I take this and extrapolate it to this model, there's 2 muscles on top here, and this is a right eye, and we're looking on the lateral side. The top is my levator palpebrae superioris, and this is the one that controls our eyelids to look up. Underneath that one is my superior rectus, superior rectus. So both of these are controlled by oculomotor nerve. Superior rectus is to help us to look up. So I use both of these not only to move my eyelid up, but to move my eye as well. So I have those 2 on top. Then I have medial rectus that's hiding in the shadow here. And medial rectus also controlled by oculomotor, so I can look towards the middle or medial side towards my nose. Inferior oblique is my other one that's wrapping at an angle. So it starts here, but would come underneath and wrap to the other side going medial. So inferior oblique, also controlled by ocular motors, helping to roll and look up laterally. So this is inferior oblique. And then underneath you can see inferior rectus. Inferior rectus helps us to look down. So I just covered all the muscles to help control by way of the oculomotor nerve. So 1, 2, and then 3, 4, and 5. So levator palpebrae superioris, my superior rectus, my inferior rectus, my inferior oblique, and my medial rectus, all controlled by oculomotor nerve. Then I get into my superior oblique. As I come up, you can see it coming over across here, and it sweeps across on the top here. So it's on the medial side as it wraps around. Superior oblique is controlled by cranial nerve number 4, my trochlear nerve. So when I look at superior oblique is helping to roll and look down laterally. Superior oblique, And then lastly, my lateral rectus. So this is all on the lateral side. This is for control by abducens, cranial nerve number 6, helping you to look to the lateral side at an even angle. So these are the extrinsic eye muscles that we're learning to help control the movement of the eye and the eyelids.